everyone. So you've learned a lot about fractures of the foot today. And calcaneum fractures, as you might have seen, are managed in different ways. Calcaneum malunions, because of the high number of calcaneum fractures, is common. So calcaneum malunion is something that you will find in your exam, not just in your theory, but also as a part of the case. Calcaneum malunion is a case that is often given in DNB exams, and you should basically know how to evaluate a patient who has a calcaneum malunion. And you can evaluate a patient with a calcaneum malunion if you know something about it. So traditionally, calcaneum malunion was almost akin to subtalar arthritis, although with time over the last 3 to 4 decades, it has been realized calcaneum malunion is not only subtalar arthritis; it is a lot more. And in that lot more, a small part is subtalar arthritis. If by the end of this talk you can understand this concept, a lot of it, my large part of my job would have been successful in the next 15 to 20 minutes. So as you can see, subtalar arthritis has several causes. One of the common causes is this, and you should also know that calcaneum malunion is not just subtalar arthritis, it is something that is a lot more. And you can see a patient who has a calcaneum malunion and who will have typical symptoms of pain, and the pain will be very diffuse. It is your job as an orthopedic surgeon managing a patient who has a calcaneum malunion to find out what is the pain generator, because there are several pain generators in a patient who has a calcaneum malunion. These patients tend to have painful stiffness in the morning. They have the pain gradually eases off but becomes constant with time, and they have pain with walking, especially walking on uneven ground where the subtalar joint moves. They will also have a limp if the calcaneum is badly malunited, and they will also have persistent swelling from the initial trauma. And when you examine them, that is when you get an idea about a lot of things. So you get an idea of the heel. The heel may be gone into valgus, or it may be gone into varus. So that is an important part of evaluation of a patient who has calcaneum malunion. In patients who have calcaneum malunion, they will also have problems with subtalar movement. So what are the subtalar movements? Inversion and eversion. So those subtalar movements will become painful, they will become decreased. In patients who have subtalar arthritis, which is almost imperative in a patient who has calcaneum malunion, will have pain and tenderness over the laterally over the subtalar joint. So another important concept is limited ankle dorsiflexion. You have to understand that patients who have calcaneum malunion, although calcaneum has no part in the ankle joint, it can lead to a decreased ankle movement. And how can that happen? I will explain it to you in the next slide.